Good evening, everyone. Thank you so much for joining us. My name is Carrie Ann Viennes, and I'm the Associate Director of Graduate Admissions. And I won't keep you waiting. I just wanted to do a few housekeeping items before we begin the presentation. This is our hot topic in healthcare and why design matters in healthcare. Please feel free at any point in the presentation to type your questions into the empty questions box on the bottom right corner of your screen, and we will read them out and answer them at the end. And also, this session is being recorded, so if you need to refer back to it or share it with a friend or colleague, this recording will be coming to your inboxes tomorrow morning. So without further ado, again, this is me, Carrie Ann Viennes, Associate Director of Graduate Admissions. I primarily handle recruitment for our health sciences program. Let's see. And I will hand it over to Lydia. This is Lydia Slay.
Hi, everyone. My name is Lydia Sly. I am the Doctorate of Health Science Graduate Assistant. I'm in my second year in the DHS program here at BayPath. And I'm going to help introduce our speaker today. So this is Elisa Watson. Please correct me if I got your first name wrong.
You got it right.
Perfect. So our healthcare hot topic tonight is why design matters in healthcare. And our guest speaker is Elisa Watson. She is an award-winning creative director with 20+ years of experience in multimedia, marketing, and design across a variety of industries, including healthcare, nonprofits, B2B, and B2C. She is a passionate and innovative partner in the creation and implementation of cross-platform campaigns. Throughout this presentation, feel free to submit your questions via the chat, and myself and Carrie Ann can field those. And we will also have time for a Q&A at the end. So now please welcome me join me in welcoming Elisa Watson.
Hi, everyone. Thank you so much for attending. I'm really excited to talk to everyone today about why design matters in healthcare. And I don't know if I have control now or if I don't have control for, can I click through? Let's see. There we go. So you just heard a little bit about me, but I really love design in healthcare for a multitude of reasons, and not just because I spent 5 years working for the corporate marketing department at MedStar Health, which is a large healthcare conglomerate in the tri-state DC, Maryland, Virginia area. And then now I work and have been working with nonprofits for about a decade. So just over a year ago, I launched my own agency with a business partner, and so we've been running since then. But I feel very strongly about design in healthcare especially, but of course design overall. So with all that said, we're going to go ahead and get started and talking about why graphic design matters in healthcare. Okay, so did you know that 65% of the population are visual learners? And I love to start with a statistic. One, because I'm a graphic designer and we love small, short little stats. But two, because this tells you everything you need to know, almost, about why design matters, right? We're visual learners. Information is wonderful, but sometimes it's just information and you want it to be more. So as you guys know, graphic design is used in almost every industry, right? Most people think about it as a marketing tool if you want to sell something to someone or you want to raise money. But in the healthcare sector, it really plays a critical role for 3 reasons. It enhances communication, it builds trust, and it encourages action. So we're going to talk about those 3 things today. And keep in mind, I know that this will be a 3-part series, so there will be at moments parts where I say, hey, we're going to talk about that in more depth at a later date. But for today, we're going to focus on these 3 pieces of these 3 reasons why design plays such a critical role in healthcare. All right, so communicating complex medical information. Even in my bio, I realized there's a bunch of graphic design jargon, right? So everyone in the healthcare field, right, whether you are a PhD in public health, whether you're an OT, a PT, a nurse, a doctor, anyone really, including the people in the marketing departments at hospitals and healthcare places that provide healthcare, or even are in communication with any sort of healthcare connection, have jargon that they use. So being able to communicate that complex medical information is vital. So we're going to talk about that, right? Medical information, again, whether it's informative, whether you're looking for someone to, do something specific, can be really overwhelming and sometimes difficult to understand. So the way that we tackle that with graphic design is to simplify complex concepts and information with infographics and visual aids, color coding and hierarchy, and icons and illustrations, right? Okay, so here's some examples. For a great example of a poor design, I don't have a lot of examples of poor design. I don't want to say bad, just poor, because I think that everyone is just always doing their best, right? But what you'll see is the difference between just a flat list and then a very clear design that allows for the side effects of chemotherapy and radiation to be understood, right? And to be understood in a variety of ways. One, with the infographic and visual aid of people, and then of course what those symptoms or side effects are, right? So the hair loss, the skin changes, nausea and vomiting, fatigue. This is a great example of just something that's very simple, right? Both of these things are very simple, but one is very clearly a better option and a better way to communicate with people who need to see this, right? Okay, so color coding and hierarchy. Color coding and hierarchy are so important for a multitude of reasons, but it can really help with clear hierarchy and communication of what's most important. Where do you want people's eyes to go first, right? So for example, we have this digital ad for this Eye on Your Health. This is a recurring series through the Wilmer Eye Institute. So you've got nice big type, a beautiful image, and this Eye on Your Health sort of is in the same place. And of course, you've got different size text. The color coding is also important. Eye on Your Health and questions with their Wilmer logo is all in their maroon, while we have the other information that sort of comes and goes, right? Those different tips or that different information in their navy blue. And then on the right, you'll see this very complicated foreclosure flyer for a nonprofit organization that provides legal services. So Shore Legal Access wanted something that people would be able to understand, right? And I think a great way to look at color coding is that sort of foreclosure process, right? So you've got like day one, you're in the green, you're doing great, and it kind of goes from green to red. Green, you're okay. Yellow, you're in a little bit of trouble, and red, you need to take action right now, right? And so color coding and hierarchy are really important. Hierarchy too, I just want to note, is the size and where you want people to look, what's most important. So the foreclosure is a great example. We've got this nice big title, we have some smaller subtitles, and then some information past that. But somebody can look at this and immediately understand that this is a flyer about foreclosure. Somebody can look at the Wilmer Eye Institute ad and know immediately that, this is 5 tips for cataract surgery recovery. All right, next is icons and illustrations. What I love about icons and illustrations is that it allows for you to communicate without words, which is really important in our country where there are lots of different languages spoken and lots of different reading levels, which we will touch on later. So especially when you're communicating complex medical information, or if you just want to give people easy tips for taking pictures, right? It's nice to incorporate that visual break for people. So icons and illustrations are another great just like moment for everyone's eyes to take a break from reading the words and comprehending the words and using pictures to go along with it. So I'm not saying they're interchangeable, they can be, right? But for example, in the 20 degrees flyer, you have operations and sustainability, right? So we have this interesting kind of graphic with this person's like geometric head and a gear, right? And then tools, training, and coaching. we just wanted some breathing room because this flyer in particular has a lot of text. So allowing to include those icons gives just that visual interest and breathing room so that it isn't just a page full of text because, well, frankly, no one wants to read that. All right, and then we're going to move on to the second part, which is building trust, right? So it's interesting, right? When we think about the healthcare field, again, no matter what part of the field you're in, trust is almost the biggest currency, right? Because we're not trying to sell someone something, right? I'm not creating a campaign to sell flooring. I'm creating a campaign to inform, or I'm creating a campaign to say, hey, we have a new doctor, or you should know about this service, or, right? So there's a variety of ways, and marketing and outreach materials have to be designed to educate and reassure the audience. It's vital, right? So in building trust, the way that you do that, and again, here we go, challenge, patients, caregivers, and medical decision makers need to build trust with healthcare information sources. Graphic design, we help build that credibility through consistent branding, clear professional layouts, and accessibility and literacy considerations. So, for example, consistent branding is very important. Everybody loves lots of colors. I'm a huge fan of the rainbow, and I would put it on everything if it made sense. But it doesn't make sense when you want to promote consistent branding, right? So all of the things that you see in front of you are different pieces of work that Wilmer Eye Institute has produced. Everything from an alumni reception at the AAO conference to a digital ad campaign to a poster installation, and even their centennial logo, all of which follow and sort of fall into a brand look and feel. It doesn't mean everything has to look cookie cutter. You can see you have some variation, but it all looks like it's coming from the same voice and the same thought. So this is really where that consistent branding comes in. And with healthcare, it's so important because those brands that people think of, like Mayo Clinic or Cleveland Clinic, which is, I think, the example that I used earlier, those names have that immediate sort of trust, and not necessarily because they've earned it from you personally, but because of their historic reputation. So that's what you're looking to also build, is that trust. And part of that trust comes from your reputation, and consistent branding can help with that. All right, clear professional layouts. Again, I love to just like throw words on a page, but then I wouldn't have a job and I wouldn't be so great at my job. So being able to give complex information and organize it in a professional manner is vital. This is probably my best example because these flyers are very text heavy. We pulled in a few pictures here and there when we could, but they're very text heavy, and they're text heavy for a reason, and it's because of what they're about, right? So the subject matter on each of these flyers. However, being able to organize the information in a way that doesn't overwhelm, right? Like even looking at this now, it might feel overwhelming, but if you needed information about a reduced free referral program or bankruptcy or consumer debt, and you only saw one of these at a time, it wouldn't be so overwhelming. It would the goal is to have you feel relieved when you pick this up because you've got the right information in your hands. So again, keeping that kind of consistent branding along with professional layouts can really, really help. And then I want to talk about accessibility and literacy considerations. This is one of those things that we're going to talk about in detail later on. I think that's going to be the third session, but it's very important. We're going to talk about the average American reading level, which is in 7th to 8th grade, and 54% of adults in the US read at below a 6th grade level. So whenever you are creating something, think about the audience, of course, first, and then take those literacy considerations into account. Now, it may not be relevant, right? It may not be relevant if you're doing a poster for the occupational therapy conference that just happened in Philadelphia, right? Like maybe that isn't a concern because your colleagues will be looking at it. All of the other pieces should still be considerations. Again, it's about who your audience is, but keeping in mind that if your audience is an average American, that you also need to be thoughtful about what kind of words you're using and how it reads so that people can understand it. All right, and then I'm gonna look at the left and we're gonna talk about good contrast and bad contrast. This is vital, no matter what reading level you are on. Contrast is extremely important for more than one reason. One, for just plain readability, and second, for anyone who has any sort of color compromised vision. So if you are colorblind at any level, and there are lots of different levels, then you may not be able to see the orange on the red where you would be able to see the white on the red, right? And this light gray, this blue on blue, the gray on yellow, yuck, right? You can see very plainly here in this example what works and what doesn't as far as contrast. There are a lot of resources online for contrast testing, and so I would encourage everyone to make sure that you are thinking of contrast whenever you're working, whether you're working in a digital space, right, and you're creating something that's only going to be seen on a screen, or whether you're working in a print space and you're going to have have a poster blown up and at a conference. You want to make sure that you're using contrast in a way that allows everyone, including again the vision impaired and the color vision impaired, to be able to read it. Okay, and then our last part is promoting action. Now, this means something different to everybody, but basically, the challenge is to help encourage patients, specific audiences, again, there's that word, and healthcare industry leaders to take action, right? So what that action is, it depends on what the project is, depends on what you'd like them to do, but a clear call to action and an engaging campaign or an engaging project is really the best way to tackle this. So clear calls to action, this I think is one of those things that eludes a lot of people, even a lot of designers, I think sometimes. But a clear call to action is just, hey, this is what I want you to do. For example, we have the MBLS. This is for their legacy society. So if you want to leave them money, this is a postcard that they sent out to people who had previously given at a certain level and were of a certain age. So it was very targeted, but it is very clear. Right? You can make Justice for All a part of your legacy. And then, hey, have you thought about it? And here's who to contact. And then another example, of course, is the We're Moving. Wilmer Eye Institute is moving their Bel Air campus to a Water's Edge campus. They wanted to make sure everyone knew they were moving, but the most important thing is really making that appointment. And so that Make an Appointment Today button, even though it's not technically a button because the whole entire digital ad is a button, creating that button feel makes people feel like they should be clicking it. And so again, having those clear calls to action. What is it that you want people to do? And then tell them exactly how to do it, which sounds silly, but it's very true. All right, and then we have engaging campaigns. So this is similar to Wilmer, where you have that consistent branding, right? You can engage your audience in different ways. So an engaging campaign means knowing who your audience is and then making sure that you are designing things and thinking about things from a perspective that they'll enjoy. For example, the Gunpowder Valley Conservancy does a Explorer Challenge every year where they tell people, hey, come and walk the Gunpowder Valley watershed and go to different places that support us. That's the little passport on the right. Get these little stickers, and then you get a t-shirt and a pin. And usually people who like hiking like to travel, or at least like postcards, they know where they're looking at, right? So all of this has that feel to it where it has a sort of vintage large letter postcard feel, and then the passport is a little folded passport that they'll literally physically take with them places. And then there's an entire digital campaign that goes along with it. But you can see how this would tie very well to a challenge to go walk the watershed and to learn more about Gunpowder Valley Conservancy. All right. And then this is just something I always like to think about, is that investing in good design leads to better outcomes and higher levels of comprehension. If it looks good and is easy to read, people will pay attention. So utilize words and graphics to create something for the audience and making sure that people will want to pay attention to it. That is all I've got for this. So that's the end. And if there are any questions, which I'm sure there will be, or at least I'm hoping there are, because this was a really light touch on why graphic design is so important in healthcare, but I would love to answer any questions if you have any.
Great. Let's see. Thank you, Elisa, for sharing your expertise. And as she said, we welcome questions. So please, let's see, feel free to type them into the empty questions box. I can already, let's see some coming through. So we will field those as they come in. Please excuse me, my computer is running a little bit slow this morning, this evening, pulling up the questions, but we'll grab them. Let's see.
And I apologize.
Okay.
I had timed myself and it was a little longer, and then all of a sudden I've run through it so quickly.
No, it was a fantastic presentation here. Let's see.
Ooh, I love this question. Do you encourage the use of Canva? How do you avoid copyright? Okay, well, those are really two questions. I'm going to tackle the do you encourage the use of Canva first. I want to tell you, I have a professional Canva account. I am connected to probably 6 different nonprofits at the moment where I have admin access. I have helped set them up to have brand kits in there. I create templates in there. And what's great is that if you are a non-designer and you can use Canva, the more you use it, the better you'll become at it. And it really has gotten a lot more user-friendly and intuitive. I think the UX has really been bolstered by feedback. They're great about taking feedback. So I like to tell people, I'm not worried about Canva taking my job, right? I do a lot of branding and I do a lot of things that I don't think Canva will ever be able to take away, right? Including that strategy that goes behind all of this and the big picture things. But Canva is an absolutely wonderful tool. And I highly encourage people to jump in there. If you're willing to pay the $120 a year for the professional account, you can save your designs. And then you also have access to a variety of templates that are already built in Canva so that you can then update the colors. Maybe you prefer other colors or you brand colors that you want to follow. And then as far as copyright goes, so yes, for Canva, everybody go get it. It's awesome. And then you can just do a free account and then it's fine too. And if you have Canva questions, I could talk about Canva all day. And again, I work in it really as a tool for my clients. It's not where I design, but it is where I create things for my clients to be able to utilize outside of it. So it's a fantastic tool. All right, so then avoiding copyright. One, don't grab random images off of the the internet, because that just is not okay. There are some really secure sites where if you really needed stock imagery or you needed to purchase something, I am a huge proponent of iStock. They are much more reasonably priced than like Getty or Shutterstock images. When I worked for MedStar, which will date me, because I worked there a long time ago, but we actually purchased large volumes of stock imagery, medical stock imagery on DVDs and had to like go through them. It was pretty crazy. So it's a very different world now, but avoiding copyright issues is a huge thing. So one, make sure that if you are going to use someone's photo that you've reached out to, you've either purchased the license to use it or you have reached out to the owner and been given permission to use it, and then make sure that you credit them at the bottom, or credit them somewhere. So that would be as far as, you know, copyright goes. Now that's only for imagery, right? If you want to talk about copyright for healthcare, for the actual content, I'm not the person to talk to you about that. But as far as imagery goes, you're finding some online resources. Canva, again, is another great one. They have a great stock library. And if you have the professional account, then you have access to a little bit more variety than just the regular account. And I don't work for Canva. I don't make money off Canva. I just really appreciate it. So I appreciate that question. All right, can you give me an example where poor design had serious consequences in a healthcare context? Actually, I can. So when I was working for MedStar Health, working for the corporate marketing department is very different than working, say, in individual hospitals, because we had these larger budgets where we were saying, hey, we want to inform people that Franklin Square Hospital Center got CyberKnife, or we are having a research study, and we need people to participate. And how do we get those people to participate? And so then we would have to build campaigns based on patient information that we were allowed to use, that we then could like touch base with them. So what I would say is, it's not necessarily about like a serious consequence, right? Like, you know, graphic design is not life or death. And so I would never want to put it out there that it's that important. But when I worked for MedStar, and I still feel like this today with my nonprofits, I feel like when I can design something and people want to read it and they are engaged with it, then in a way I am helping them get to that medical research study, get to that information session about CyberKnife, get to that new pharmacy that's opened that has different hours so that it's more accessible to people that live in a specific area, right? So it isn't necessarily about like a negative outcome, it's about more positive outcomes, right? It's about making sure that the people who need to read the information, that it's written at a certain level so that they can read it and comprehend it, making sure that it looks nice so that people want to read it, and getting it into the right hands. So again, we had a huge sort of unveiling when we obtained CyberKnife at Franklin Square Hospital Center. And I still say I haven't worked for MedStar in over a decade, but there's something about it where you just still say we. And it was a really big deal, but most important was making sure that people knew that it was available, because it hadn't been available in all of Maryland yet. At the time, Franklin Square Hospital Center was the only hospital in Maryland that had CyberKnife. So it just was, again, it's just about educating and making sure that the right information is getting in front of the right people, and that it looks interesting and beautiful enough for people to read it. Like, you can send anybody a black and white letter on a piece of paper. That doesn't mean they're going to read it. So how do you get people to read it? Because people are inundated with information constantly, all the time now, right? On their phones, on TV, in the mail. How do you get them to actually hold on to something and read it, or catch, or stop scrolling and read it? Because again, now everything is so digitally based. I hope that's helpful. All right. All right, next, how do cultural differences, did I miss something? No. How do cultural differences factor into healthcare design? That's a great question too. So depending on who your audience is, you may need to alter things. Actually, everything that you just saw for Sure Legal Access has been translated into 3 different languages, because the people that live in that area that they service speak Haitian, Spanish, and English. So everything has been translated twice, and then everything gets reviewed so that it looks nice too, right? So we build everything as a template and then translate everything. So I think it is also very important to keep in mind who your audience is. For example, Baltimore Healthy Start is another nonprofit that I work with, and when the COVID vaccine came out, we did a campaign about getting vaccinated and the support to do so, and like where they were having pop-ups to be able to go get vaccinated. So when we thought about that campaign, it wasn't just like, okay, like people should come because they should know. Like, no, we strategically placed billboards in both English and Spanish throughout different neighborhoods in Baltimore City. We also did door hangers, right? So those little door hangers, we had people, we were really lucky. There were volunteers at the organization that were willing to go and put door hangers on people's door hangers, on people's doorknobs. And we also did postcards, we did a digital ad, we did bus skeins, which are those long sort of advertisements on the sides of buses, because again, the population in Baltimore that we were targeting are bus riders because we don't have a great metro. We have a tiny, tiny one in Baltimore City, and so the bus is really the most important and most valuable public transport. We also did bus houses, those little, that's not what they're called, but now I can't think of the word. So it's really not necessarily, you know, it's like, it's thinking about who your audience is. If your audience, if you have two audiences that speak, you know, two big buckets of audiences that speak different languages, make sure that you're translating. If you have an audience where there is specific culture, for example, like I would not use pictures of pigs or bacon I worked with actually the Jewish Community Center. Like, I'm not going to put pictures of pigs and bacon on a Jewish Community Center digital design for their digital boards that all of their members will see, right? Like, so you should keep that in mind, and then, you know, factor that in. Now, in healthcare, I know that it also can be different. So that's, again, just really something to be thoughtful of when you are tackling design and cultural differences plus healthcare have to be thought of. All right, what are some challenges designers face when trying to implement change in clinical, implement change in clinical environments? Oh my goodness. I mean, well, as designers, we tend to tackle lots of different challenges. In clinical environments, honestly, my experience has been that most of the office staff and most everyone in the offices want the materials to be better. They want their flyers and brochures and even the posters and honestly even the artwork, right? Like in an office better. Now, as far as, you know, implementing it in a clinical environment, I think again, that depends on how you're interpreting clinical environment. Is this a clinical environment that's doing research? Is this a clinical environment that is treating patients? Is this a clinical environment? You know, it just, as a non, you know, public health sector / medical industry person, right? I'm sort of tertiary, right? I would say that the challenge can be getting everyone to agree. Everyone might not agree on what good design is. They might not agree on what they want things to look like. And so working together to come to a great compromise. I have said before, and I will continue to say to my clients, I can tell you why design A is better than design B because design A has better hierarchy and better balance, and the pictures are clearer and they're more targeted towards the right audience. And if the client ends up going with option B, I can only push back so far, right? So utilizing my expertise, I can take it so far, but again, I work in a client-driven business. So at some point I just say, okay, and I will make my recommendations heard. I will raise my hand more than once, and then I will say, okay, I'll give this to you, but this is not what I recommend. And then I just don't put it in my portfolio, which sounds pretty terrible, but That's just the reality of being a graphic designer. There's plenty of us that there are plenty of projects that you work on that you look back later and you're like, wow, at the time I thought it was so good. And then now maybe it's not as great, as you learn and grow as a designer.
Great. Thank you so much, Elisa. These are the only questions I'm seeing for now, but they are fantastic ones. So I will, let's see, I'm going to go navigate to the next slide. So this is a part of a 3-part Design for Healthcare series. Let's see, and participants, you can see you can attend all or one session. And more of that information will be coming to your email, but it's Design RX, the power of visual communication in healthcare and exploring the critical role of design in healthcare communication. Each session is going to be running once per term over the next academic year, and each session covers a unique aspect of effective designs in healthcare settings. So this evening was why design matters in healthcare. The second event will be design basics, balance, type, and image. And the third will be audience and compliance. Let's see. And we always encourage questions. So if this information is sitting and you think of anything else, please feel free to contact us. Again, this slide deck and this recording will be coming to your email tomorrow morning. This is all great information to have. And thank you so much, everyone, for joining us this evening. And thank you, Elisa, for presenting.
Thank you so much for having me. I really appreciate it.
Great. Thank you so much, everyone, and have a great evening.